good afternoon and welcome to the first Heartist meeting in Rome. This afternoon, for the episode In Conversation with Knights, we have Dr. Pirtea, who has kindly accepted our invitation for a short interview. Thank you, Doctor.
Thank you for inviting me.
First question is, what is the kingdom you identify yourself with, if only one?
Well, if it only one, I would probably pick ART, but actually I am also part of the other two, so it's all combined.
Second, what is the strongest weapon of the kingdom you mostly identify yourself with in terms of technique or procedure for the infertile patient workup?
Well, I think that ART has had its incremental progress in helping infertile patients, because this helped to improve outcomes in endometriosis, which is a very common disease in infertile patients, even more than, for example, ultrasound or hysteroscopy, in this case particularly.
Considering the latest recommendations,
yes,
if you could fight for one update or modification regarding the workup of the infertile patient, what would it be?
I truly believe that we have to make the best workup up front before starting doing IVF. I think this is very important in order to identify different problems that can hamper IVF outcomes.
Perfect, thank you. Going on, what is your unpopular opinion in your kingdom regarding the infertile patient management?
In my field, one of my beliefs and some of the data that I have published actually shows that recurrent implantation failure is a very rare event, even debated whether it really exists or not, and I think this is very countercurrent and it has been very debated recently.
Thank you very much. Next, at the opposite, what is the most medieval practice still going on in your kingdom?
I truly believe that in our field the agonist protocol that was the first one to be used should be abandoned, and people should migrate towards the use of antagonist protocols, which are much safer, and it seems to be even better, more patient-friendly.
What is your unpopular opinion among the other knights in your kingdom regarding the infertile patient management?
Well, most of my recent publications and the data that I've reported actually shown that the prevalence of true recurrent implantation failure is very low, lower than 5% or even more, lower than 2%. And I think this has been a lot debated recently.
Thank you very much.